Welcome students. Let us start certain high yield questions related to NEET 2021. Okay. Now, just see. When does the mitral valve open? Mitral valve opens at what time? Is okay. At the end of isovolumic contraction, at the end of isovolumic relaxation, during protodiastole, or start of the second rapid filling. Okay, such type of question can be attempted if you have a very clear-cut idea of the cardiac cycle. Okay, what is happening, which is happening in which phase? Okay, very commonly asked question. Okay, so what you can make out in this question, mitral valve opening. Okay, so what does it mean? If you see this heart is a 4-chambered structure. When this mitral valve opens, this is the mitral valve and it opens. When mitral valve opens, the blood will move from here to here. So there will be left ventricular filling. This chamber will fill. Okay. So this is actually relaxation. This is actually diastole. Ventricle is relaxing and this is filling. So isovolumic contraction, no, it has nothing to do with the contraction. Isovolumic relaxation, yes, this is the answer. This is the answer. During protodiastole, no. Second rapid filling, no. When mitral valve opens, the blood moves from here to here at a very high speed. The mitral valve opens, the pressure of the left atrium is more than left ventricle. So blood moves from here to here at a very high speed. And this phase is known as first rapid filling. First rapid filling. This is okay. This is first rapid filling. Mitral valve opens, blood goes, and this is the first rapid filling. In the last part of filling, this atrium contracts. And because of that atrial contraction, blood will again move from here to here. And this is the second rapid filling. This phase is known as second rapid filling. First rapid filling is actually passive. If you see the first rapid filling, it is passive. But second rapid filling is active. It is because of the atrial contraction. Is okay. So second rapid filling, no. No. Second rapid filling is because of the atrial contraction. Mitral valve has already opened. This is okay. So at the end of isovolumic relaxation, okay, when this left ventricle will relax, pressure in the left ventricle will fall. When pressure of the left ventricle falls to a level which is below left atrium, mitral valve will open. So initially you will have the isovolumic relaxation, and after isovolumic relaxation, the mitral valve will open. Is okay. So this is the most appropriate answer here. I'll again stress on the fact that such type of questions can be better answered if you have a clear-cut idea of the cardiac cycle. We have discussed in our lectures many times in detail about the cardiac cycle, each and every event. When will the mitral valve close? When will the aortic valve open? And how the cardiac cycle proceeds. Okay, once that concept is clear, then such type of questions can be very clearly answered. Okay, if concept is not clear, then you have to apply half-baked concepts. And accordingly, you can make out that at the end of this, we will record the opening of the mitral valve. Done? Okay, this question. Highest total cross-sectional area. Okay, it lies in highest total area of cross-section. Okay, now if you see it, this is heart, this is arterial site. Okay, artery, then arterioles and smaller vessels, and then we have the capillaries, and finally we have the veins, peripheral veins, and then we have the central veins. Forget about the heart. We are proceeding from here to here back. This is aorta, arteriole, capillary, peripheral vein, central vein. What about the total area of cross section? Total area of cross section in aorta. This is the total area of cross section. Very small total area of cross section, only this much. Gradually, this will divide and divide and divide. So total area of cross section will start increasing. Okay. If this is the total area of cross section, then total area of cross section will start increasing. And at the level of capillary, it will become maximum. Okay, vessels are dividing and dividing and dividing. So large number of capillaries. If you add the area of all the capillaries, very high area of cross section. And here vessels will start merging again. Again, total area of cross section is less. So again, total area of cross section will start falling. This is okay. So where do we have the highest total area of cross section? In the capillaries, we have the highest total area of cross section. Is okay. Okay, if I ask you, where do we have the minimum total area of cross section? What should be the answer? Vena cava or aorta? I think if I draw a line properly, then it will be like this. So minimum total area of cross section will actually lie in ascending aorta. Maximum total area of cross section lies in the capillaries, and the minimum will lie in the ascending aorta. Is okay? If I ask you the same question, like where do we have the maximum velocity? Maximum velocity of blood flow. Now, that maximum velocity of blood flow is inversely related to the total area of cross section. Okay. More the total area of cross section, less will be the velocity of blood. And lesser the area of cross section, total area of cross section, more will be the velocity. So it will be just the reciprocal of that. So velocity will be maximum in aorta, ascending aorta, then decrease, capillary is minimum, then again in the vein, velocity will become more. So again, if you ask me, where do we have the minimum velocity of flow? Answer will be capillary. And maximum velocity of flow, answer will become ascending aorta. Not the vein. No. In the ascending aorta, it will be slightly more than vein. Okay. So maximum area of cross section lies in the capillary, and therefore In the capillary we have minimum velocity. Velocity of flow is minimum. It is the reciprocal of the total area of cross section. Is okay? So highest total area of cross section lies in capillaries. If I ask you where do we have the highest resistance, then the answer will become arterioles. In the arteriole, the resistance is maximum. Arterioles are resistance vessels. Is okay? Veins are capacitance vessels. If you ask me where do we have the highest capacitance, capacitance means compliance. So the answer will become veins. Veins have the highest capacitance, distensibility, stretchability, compliance. Arteries, the special characteristic of arteries. What is the special characteristic of arteries? Arteries are wind castle vessels. Arteries are wind castle vessels. When the blood enters into arteries, arteries dilate, and during diastole they recoil back. This is wind castle effect. So arteries are for wind castle effect. And because of that wind castle effect, it will maintain the diastolic pressure. During systole, it dilates, and during diastole, it recoils back. So wind castle effect is the function of arteries. Is okay? Highest total area of cross section lies in capillaries. There is one more question which is sometimes asked. Who will absorb the maximum pressure? Maximum pressure is absorbed by whom? The pressure in arteries is 120 by 80. Pressure in vein, central may be 4. Okay, in the arterial system, in aorta, 120 by 80, but in the inferior vena cava, it is 4 millimeter of mercury. So who will absorb this pressure? This pressure will be absorbed by whom? Maximum pressure drop occurs in which vessel? Again, the answer of such question will be arteriole. Okay, in arteriole we have maximum resistance, and therefore in arteriole we also have the maximum pressure drop. In the arteriole we have maximum resistance, and also the maximum pressure drop occurs in arterioles. Just because they have more resistance, so there is more pressure drop. Pressure from 120/80, it suddenly drops. Is okay? So question here is very simple. Highest total area of cross section. A female complains of breast cramps during breastfeeding. During breastfeeding, she has breast cramps. Which hormone may be responsible for this breast pain during breastfeeding? Okay, estrogen, okay, prostaglandin, oxytocin, prolactin. Now, there are 4 hormones here. One is estrogen, this one. Another hormone which is missing here is progesterone. Progesterone is missing here. That is also has something to do with the breast. Oxytocin, prolactin, 4 hormones. What is the function of estrogen in breast? Estrogen, what will this do in breast? It will lead to physical growth. This will lead to physical growth of breast. Estrogen may be known as growth hormone of breast. It will lead to enlargement of the breast physically. What will progesterone do? Progesterone is not mentioned here, but what is the function of progesterone? If I make another choice here, progesterone. What will progesterone do? Progesterone will make that breast secretory in nature, not just the physical growth, secretory changes in that thing, secretory changes in that breast. Okay, that will convert the glands of the breast in a structure which becomes secretory in nature. Not just the physical growth, but that will transform it into the secretory structure. What will prolactin do? Prolactin will do the secretion of milk. Milk secretion. Milk will be secreted. Okay, this will occur during breastfeeding. During breastfeeding, prolactin is secreted, and that prolactin will lead to the secretion of milk in breast. But it is not expulsed. It is just secreted by the lobules. It has not been expelled out. No, oxytocin will do that final job. What will oxytocin do? Oxytocin will do expulsion of milk. We call it as milk letdown. Milk letdown, or you can call it as expulsion of milk. Oxytocin will lead to the contraction of the myoepithelial cells. Myoepithelial cells of the breast will contract, so milk will be expelled out. This is the function of oxytocin. So I think the cramps, when the child suckles, oxytocin is released, contraction of the myoepithelial muscles, and expulsion of milk. So I think these breast cramps, okay, it is because of this oxytocin. Prolactin will not lead to, it will lead to secretion of milk. Okay, fine. But the cramps, breast cramps during breastfeeding, I think this can be explained by oxytocin better than prolactin. Okay, estrogen and progesterone, they are out of question. Estrogen just enlargement of the breast. Prolactin secretion. Oxytocin will lead to the expulsion of milk. It's okay. You have seen these people and like how they take milk out of buffalo. In buffalo, they put an injection of oxytocin, and after giving an injection of oxytocin, the buffalo will give milk. Okay, so breast cramps can be best explained by oxytocin. Okay, prolactin is definitely there during suckling, but that cannot explain the breast cramps. It can be better explained by the oxytocin. Let's see this question, very easy question. Hormone that regulates serum calcium level. Which hormone will regulate that? I think answer here is all. Parathyroid, calcitonin, vitamin D. This one, calcitonin, vitamin D. Okay, I'll go for all. Although if you ask me which is the strongest, which hormone is the strongest regulator of the calcium level, okay, then answer will become parathyroid hormone. Parathyroid is strongest. Calcium, okay, it can regulate, it's a weak hormone, but still it can regulate that. Vitamin D, okay, to some extent it will regulate that. If you see three structures, this is the intestine. This is the intestine. This is the kidney. And this is the bone. This is the bone. Okay. What will vitamin D do? Vitamin D will absorb calcium and phosphate from intestine. So it will increase plasma calcium and phosphate level. It can regulate that. What will calcitonin do? Calcitonin will deposit calcium and phosphate in bones. Calcium and phosphate in bones, it is deposited by calcitonin. Vitamin D will absorb calcium and phosphate from intestine. And what will PTH do? Parathyroid, main action. It will absorb calcium and phosphate from intestine. It will dissolve calcium and phosphate from bones. And in the kidney, it will reabsorb calcium, but it will excrete phosphate. Is okay? So this black color, this is the action of vitamin D. This one. This is the action of vitamin D. Absorb calcium and phosphate from intestine. This one. This red color, deposit calcium and phosphate in bones. This is the function of calcitonin. And PTH has action on all. It will absorb calcium and phosphate from intestine. It will deposit calcium and phosphate in bones. In the kidney, it will reabsorb calcium. And don't forget that phosphate is actually reverse. Phosphate is actually excreted. This okay? PTH has a phosphaturic action. So in this question, I'll go for all. He's not specifically asking that what is the action of that hormone. He's simply asking about the regulation of calcium. Okay, I'll go for all. See the next question. A monkey is having increased sexual activity, increased appetite, anger, and no fear. Monkey is fearless. This may be because of the injury to which structure? This is actually injury to amygdala. If there is injury to amygdala, or if the amygdala is destroyed, you will develop such type of symptoms, and this is known as Kluver-Bucy syndrome. This particular syndrome is known as Kluver-Bucy syndrome, and the loss of fear and increased sexual activity. Okay, these are the okay. This Kluver-Bucy syndrome is quite complicated. Okay, but it is somehow related to amygdala. Okay, and these may be the manifestations of Kluver-Bucy syndrome. If hippocampus is gone, what will happen? Amygdala will lead to Kluver-Bucy. If hippocampus is destroyed, then what will happen? You will develop anterograde amnesia. Anterograde amnesia. Okay, anterograde amnesia is produced because of the destruction of hippocampus, in which the memory is lost. Anterograde. From that day onwards, nothing will be consolidated. Okay, so this is actually related to Kluver-Bucy syndrome. Done. See this question. A scientist performed an experiment and recorded what? Bradycardia, number 1, and hypotension, number 2. This may be because of low heart rate and low BP. Heart rate is low and BP is also low. This is something which was recorded. So which reflex will produce this thing? This thing will be produced by which reflex? This thing is produced by Bajord-Jaris reflex. Bajord-Jaris reflex. This Bajord-Jaris reflex, this is also known as coronary chemo reflex. Another name of this Bajord-Jaris reflex is coronary chemo reflex. Bajord-Jaris reflex or coronary chemo reflex. What is this reflex? Bajord-Jaris, what is this reflex? Now, this reflex says that if you inject certain chemicals like say capsaicin, phenyl diguanide, serotonin. If these chemicals are injected into where? If these are injected into left ventricle, what is seen? If these chemicals, these particular chemicals, if they are injected into the circulation of the left ventricle, a peculiar thing is seen. What is seen? What is observed as a reflex? What is observed? Apnea followed by rapid breathing. First apnea, which is followed by rapid breathing. Bradycardia and hypotension. Low heart rate plus low BP. That means if I inject these chemicals, then this thing is seen. If I inject these chemicals into the left ventricle, then these things are seen. This reflex is known as coronary chemo reflex or Bajord-Jaris reflex. If I inject these chemicals into the circulation of the right ventricle, right atrium, and left atrium, nothing will be seen. If I inject these chemicals again into the circulation of the left ventricle, same thing will be seen again. So there must be something in the left ventricle who is doing this job. There must be some receptor in the left ventricle who is doing this. What is the significance of this thing? We don't know, but it is there. Is okay? If we inject these chemicals, then this thing is seen. What is this indicating? We still don't know. But this reflex is known as Bajord-Jaris reflex or coronary chemo reflex. Done. If I inject the same chemicals into the lung, okay, not in the left ventricle, right atrium, left atrium. No, if I inject it into the lung, then also same thing is recorded. What is this reflex known as? This reflex is known as pulmonary chemo reflex. It is the same thing which is coming from lung. So we call it as pulmonary chemo reflex. Is okay? So this type of reflex will either come from left ventricle, or this type of reflex can also come from lungs. Coronary chemo reflex pulmonary chemoreflex. Okay, this is Bajor-Jaris reflex. The significance we don't know. Okay, but it is there. The only importance of this, what is that? That is in the setting of myocardial infarction. Suppose we have a patient of MI, myocardial infarction, and in that patient of MI, suppose I am recording this low heart rate, bradycardia, in a patient of myocardial infarction. What do you suspect? In a patient of myocardial infarction, you are getting bradycardia. We usually suspect that there may be some heart block, but sometimes it is not related to heart block. And this bradycardia is very stubborn. It is not responding to any treatment. It is very stubborn bradycardia, which cannot be explained by heart block. Sometimes we explain that bradycardia, unexplained bradycardia in a patient of myocardial infarction because of this reflex, Bajor-Jaris reflex. Sometimes this reflex can explain that bradycardia. We presume that maybe because of the myocardial infarction, certain chemicals are released by the damaged myocardium, which may be very similar to this capsaicin and phenylalkylagonide, something like that. And maybe those chemicals released from the damaged myocardium can explain that bradycardia. Okay, so this is the only applied importance of this reflex, that it can explain bradycardia in a patient of myocardial infarction. Is okay? Bradycardia and hypotension. Bainbridge reflex is something else. What is Bainbridge reflex? Bainbridge reflex, this is Bainbridge reflex. Let's see. Heart is a 4-chambered structure. 4-chamber. If I stretch this right atrium, if I put a balloon in the right atrium and stretch it, okay, left atrium also, but if it is stretched, or say there is more blood volume, or suppose you infuse the saline will straightway go to the right atrium, and right atrium will be stressed. So whenever right atrium is stressed, whether because of the more blood volume or whether because of the infusion of saline, there are some receptors in the right atrium. Signal will go to the brain, it will come back to the SA node, and the heart rate is increased. Right atrial stretch increases the heart rate. Okay, there are type B receptors in the right atrium who will do this. There are type B right atrial receptors. They will fire when atrium is stressed, and signal will go to the brain, back to SA node, and the heart rate is increased. Right atrial stretch increases the heart rate. This reflex is known as Bainbridge reflex. Tachycardia produced by right atrial stretch. This is Bainbridge reflex. Is okay? Chemo reflex is something else. Okay, it is coming from carotid body and aortic body. That is something else. Okay, and Cushing's reflex may be related to CNS ischemic response. We have discussed in our class in very detail. What is this Cushing's phenomenon? What is Barrow reflex? What is chemo reflex? They are different things. Okay, so answer here is very clear cut. It is going towards Bajor-Jaris reflex. Is okay. This is point number 1, and this is point number 2. Bradycardia and hypotension. Apnea followed by rapid breathing, bradycardia and hypotension, produced by infusion of these chemicals. Is okay? Concentration of which substance is decreased at the end of PCT? If you see, this is the Bowman's capsule. and this is the proximal convoluted tubule, and this is going towards loop of Henle. Okay, this will ultimately go to the loop of Henle. At the end of PCT, whose concentration is decreased? Glucose. Just see. Glucose here is 100% reabsorbed. Glucose reabsorption is 100%. 65% water is reabsorbed. How much water is reabsorbed? 65%. Glucose reabsorption is 100%. So glucose concentration here at the end of PCT will become 0. No glucose here. Okay, glucose concentration falls by the end of PCT, rather it becomes 0. How much urea is reabsorbed? Urea reabsorption in PCT is 40%. Urea reabsorption 40%. In any case, 65% water is reabsorbed. Only 40% urea is reabsorbed. So urea concentration will actually increase. There is more urea concentration. Although 40% urea is reabsorbed, but water reabsorption is more than that. So urea concentration will increase, but glucose concentration will decrease. Because only 65% water is reabsorbed, 100% glucose is reabsorbed. Creatinine is not reabsorbed, rather it is secreted. Creatinine is slightly secreted also. Reabsorption is out of question. So creatinine concentration in the PCT will also increase. Chloride, how much chloride is reabsorbed? 65% chloride is reabsorbed. 65% water is reabsorbed, 65% chloride is reabsorbed. So chloride concentration remains same. 65% chloride reabsorbed, 65% water also reabsorbed. Concentration of chloride remains same. This is okay. So what is the question? Concentration of which substances? Concentration of which substance is decreased at the end of PCT? What is the answer? Answer is very clear cut, urea. Sorry, glucose. Urea will increase, creatinine will increase even more than that. Chloride will remain same. But glucose at the end of PCT, it will disappear. Okay, so you should have the idea like what is happening in PCT, which thing is absorbed, which thing is not absorbed, which thing is secreted. Okay, let us discuss the last question here. Very high yield question. Fourth heart sound is because of fourth heart sound. First heart sound is because of mitral valve closure. Why do we have first heart sound? First heart sound is because of mitral and tricuspid valve closure. Mitral closure and also tricuspid closure. Second heart sound is because of the aortic valve closure. Aortic valve closure. Now, third and fourth, they are not because of valve closure. They are not valve closure sounds. Third heart sound is because of first rapid filling of the ventricle. First rapid filling of the ventricle. And fourth heart sound is because of second rapid filling of the ventricle. This okay, they are rapid filling sounds. Done. If you see the heart, I'll draw it here again. Heart is a 4-chambered structure. Now, if you see it carefully, that when left ventricle relaxes, mitral valve opens, blood moves from left atrium to left ventricle at a very high speed, and that will lead to turbulence. And turbulence will lead to sound. Opening of the mitral valve will not lead to the production of sound, but turbulence at a high speed. This is third heart sound. And fourth heart sound is, it will coincide with this atrial contraction. When this atrium will contract, blood will again move from here to here at a high speed. Again turbulence, again sound. So fourth heart sound is because of the second rapid filling, which actually coincides with atrial contraction. Second rapid filling, or you can say atrial contraction. Atrial contraction will not produce sound, but with the atrial contraction, there will be second rapid filling that will produce sound. So what should be the answer? Fourth heart sound is because of rapid ejection. No. Ventricular filling, this may be the answer. Second rapid filling, not the first. Aortic valve opening. No. This is aorta coming out from here. Aortic valve opening doesn't produce any sound. Aortic valve closure produces second heart sound. Aortic valve opening will not produce sound. Is okay. Mitral valve opening. This mitral valve opening. Yes, but this will be third heart sound. Mitral valve opening will lead to first rapid filling. This is third heart sound, not the fourth. So I will not go for this because mitral valve opening will explain the third heart sound. Fourth heart sound, I'll go with ventricular filling. To be very precise, second ventricular filling, second rapid filling. Second rapid filling, not the first rapid filling. Okay, so mitral valve opening, no, I will not opt for that because that will explain the third heart sound, not the fourth. So ideally the answer should be second rapid filling, ventricular filling, second one, not the first, which will coincide with atrial contraction. So this should be the answer here. Such type of questions are actually based on cardiac cycle. If you understand it properly, then these type of questions can be answered. Is okay? Just for your revision, this is first heart sound, this is second heart sound, this is third heart sound, and this is fourth heart sound. Is okay? So these were the some high yield questions which I have discussed. Thank you very much.